This is Lee Hargrave, certified strength and conditioning specialist, former rocket scientist, and I hate needles.
This is Isis Hargrave, certified OPEX Coach, nutrition guru, and I'm ready to have a good time.
And you found the enduraLAB podcast, where we dive into the science behind fitness,
the ins and outs of better health,
and lifestyle strategies to help you live a better life. You ready?
Go.
All right, so today we are pumped. We're going to be talking about a subject that a lot of people know about or have a friend that is currently on it. This is GLP-1s. Mm-hmm. And today we have with us two docs. First is my own doc, I guess Isis and my doc.
Yep.
Right? Kathe Supavong, DO.
Actually, they both could be my doc very soon.
One cannot be my doc, I guess.
I'll try.
You know, yeah. Like, I mean, we can give it a shot.
I want to see you try.
Yeah. So joining us today on the podcast is Kathe Supavong. She is a doctor over at 1-to-1 MD, practicing in family health. And then the doc that we'll give a shot, we'll see what happens, is Dr. Laura Bradford, OBGYN over at 8th Avenue, and also partner at the Fort Worth Health Collective. Welcome to the podcast.
Woo-hoo. Hello.
I guess both of you guys, welcome back, right?
Yes.
Yeah, second time, so this should be even better. So today, yes, we are talking about GLP-1s. All right, so you guys have either...
Semaglutide. What are other names? What are other names?
Oh, you'd hear Ozempic. It's got a great...
Ozempic, semaglutide.
Manjaro. What's that one?
Manjaro.
Kilimanjaro.
Yeah, there you go.
Terzepatide.
Okay.
Yeah.
Okay.
So you guys have either seen them on TV or heard about them or have
It's one
friends
of Isla's
and family.
favorite jingles.
Yeah.
Oh, Ozempic.
Yeah, our kids actually know the jingle. That's how common it is now.
Yeah.
So today we're going to just kind of explain, number one, what GLP-1s are, what they do, the history behind them. We're going to talk about strategies behind how to use them. We're going to talk about specifically nutrition and fitness because that's what we do. And then we're going to talk about how they may affect women differently or how they can be used effectively in women's health. And then maybe uncover some common myths behind GLP-1s.
Let's do it.
All right. So let's start off with exactly what are GLP-1s?
Okay. Well, GLP-1s or GLP-1 agonists, they are essentially a hormone. So it stands for glucagon-like peptide 1, which has a whole bunch of signals that it sends out. Okay. So this injection that you hear about, it actually mimics a hormone that is naturally produced in the body. And it has multiple different actions. So obviously it works in the gut by slowing it down. So people feel fuller and they can't physically eat as much. It also has effects in the brain. So it helps with decreasing appetite, getting people to feel satiated a lot faster. And then they actually also will affect the muscle, so it helps improve insulin sensitivity. It also, with the pancreas, it helps produce more insulin too. Okay. So originally these medications were developed for diabetes because of the blood sugar control aspect of it. But as you know, with medications in the past that were made for one specific indication, the most famous one being Viagra, was originally a blood pressure medication, right?
Okay. I didn't know that.
You didn't know that?
Yeah. And then at the end of the trial, a lot of the men were like, oh, we want to keep
side
taking
effect
this.
is okay, so can women take Viagra for blood pressure?
No, it's actually a horrible blood pressure medication.
Okay.
It doesn't
It's like
work.
one of those medicines that was tested for one thing and great for the
right,
other.
but in the beginning, could they? Like they figured it out then?
Yeah,
I'm just curious.
I mean, in the studies, here's the thing: a lot of women weren't in a lot of studies.
No, true.
Yeah,
We only study men.
Okay.
And wasn't the hair loss? Isn't wasn't that done for prostate health?
Oh, yes, finasteride.
Yes, that's another one.
So there's one in women's health that was being developed for an antidepressant, and it has a very mild antidepressant. but it increased libido in women. And that's how we got our first drug for
wow.
libido. It was by
Okay.
mistake.
Okay. Interesting.
So, originally developed as a diabetes medication, and then we noticed that there was this big effect with weight loss.
Okay.
And so the more studies were done to kind of further develop and hone in on that aspect of it, and these drugs are just getting better and better.
When did GLP-1s hit the market?
I mean, it's been about 15 years now.
Okay, I think that's something interesting for people to know too, that it's not as new maybe, but at the beginning the purpose was diabetic patients.
Yeah. So the first one that I heard about, I had actually just finished med school and doing rotations maybe, or even before that, but it was a daily injection. So the first GLP that I knew of, it was called Victoza or liraglutide, and that was approved by the FDA in 2010. At that time, I know a lot of the endocrinologists were very excited about the weight loss potential along with the better control of blood sugar. Then came weekly injections. So the first one after that was Bydureon or Trulicity, so exenatide or dulaglutide. These names are crazy, right?
Yeah.
They are. I'm like, bless you.
Yes. I remember with at least the Bydureon, people would inject themselves and get this huge knot almost that wouldn't go away. And so you'd see people, and while their blood sugars looked better, they had like little bumps all over their stomach.
Like multiple belly buttons.
Were they like cystic? Like hard?
It was hard.
looking?
Yeah,
Oh.
it was hard. So that was the side effect of that. And I think it just didn't, I guess, melt away as fast from the subcutaneous tissue. And then came the big blockbuster ones, right? So Ozempic, and approved by the FDA in 2017. That's the one that really got good glycemic control, didn't really have any of the injection site side effects. And people who were diabetic, who were using the medication, lost a significant amount of weight on that.
That's a long time to come up with a jingle.
Yeah,
Like 7 years,
that's right.
but they nailed it.
Yeah.
They did.
So Ozempic was the branded name of semaglutide for diabetics, and then Wegovy is the branded name for obesity.
Okay.
They're the exact same thing, semaglutide. It's just branded for a different indication.
It's like a good steak, like a Wegovy steak.
Yeah. Yeah, exactly. Wagyu. Oh, but we have a Wegovy steak over here. Let's go.
And then 2022, Mounjaro.
So what is Mounjaro? Is it the same
So this actually is a dual receptor agonist. So it hits the GLP-1 agonist site, but then it also hits GIP, which it stands for glucose-dependent insulinotropic polypeptide.
Oh,
Okay.
I was thinking that, but I was like, wasn't sure.
Now it
So
makes sense to
It
me.
works a little bit further upstream
Okay.
than where GLP-1 is, but it seems to have stronger effects on weight loss. So people who are on tirzepatide versus semaglutide have less side effects as far as nausea, diarrhea, constipation.
So that's Mounjaro.
Yes,
Okay.
Mounjaro, Zepbound. So again,
Okay.
Mounjaro, diabetics, Zepbound, obesity. Different
Okay.
indications, same thing. Tirzepatide is the generic name.
Gotcha.
And these are all have to be prescribed or can be
They
without?
should be prescribed.
Which we'll go into
Okay.
later.
Yes.
Right?
Okay.
Yes, they should be coming from a physician, someone with a medical license.
They should know face to face.
Yeah.
Right.
You should.
Yeah.
You should. Because we'll delve into the side effects and the things to watch out for
Okay.
and things to mitigate and all that.
Now these are all taken via shot, correct?
Yes, there are
With a
some
needle.
oral
Yeah.
forms. Yes.
You won't see me on it.
So there are oral forms. So I think Ribelsis, right, is semaglutide, the oral form of it. And it does work in some people, but it has to go through
The GI, right?
the GI tract. And so it doesn't work as well. It's a daily dosing as opposed to just once weekly dosing.
Okay.
Okay, so
There-
most of these are taken once a week.
Yes, the injectables. Now
I
they
have
are.
seen some people are like microdosing with more shots. That's
Well, let's talk about how to use it.
yeah.
There are also some non-prescription supplement forms of semi-glutide-like peptides that are active in the gut. And so it comes from the gut naturally.
Okay. So the weight loss, though, we've kind of talked about how it affects the body, but the weight loss that people are seeing is just coming from not eating, correct? It's not changing anything in the body per se, or is there a little bit of an
there
uptick?
is a
It's
little
producing-
bit of lipolysis, increased
Okay.
lipolysis that happens with the GIPs and the GLP-1s.
Okay.
But yes, a lot of it is really coming from the decreased caloric intake that happens from not wanting to eat.
Right. Okay.
Right.
When you
Yeah.
work out, right,
Right.
you actually have a natural increase in GLP-1. That is,
Yeah.
again, a hormone that is naturally in your body. So working out actually enhance it. If someone is exercising and they add on a GLP-1, it will enhance everything to make it more effective.
Right. To basically burn more
Yeah.
calories.
Yeah.
Yeah. So let's talk about how we would start with a GLP-1. I think it's always nice for people to know because, yes, you should get prescribed by your doc that you know face to face and you have conversations and you understand. But, I mean, GLP-1s, if I wanted one right now, I wouldn't have to ask you. I could go out and find it somewhere else. So let's
Yes.
talk about
Yes.
the other markets, right? So there's lots of teledocs that you can go on to.
Mm-hmm.
We do not encourage anyone to do that. And that just kind of goes into, there's a lot of medications that I could go out and be like, well, I want to try this and I want to try that. I could do it, but there's a danger to that.
There is. So I don't know if you guys have heard of the term Ozempic baby.
I have.
What is that?
I have.
So because it affects how the GI tract works, right? A lot of people who are on oral contraceptives or oral birth control, it affects the absorption and it makes it less effective
Oh,
is what we
man.
see. And so a lot of people are having babies in their 40s or
Oh no, like not.
unplanned, right?
Worst
So-
nightmare.
Unplanned.
and everybody's system is different. That's why
Right.
some people get constipation, some people get diarrhea.
So as far as Ozempic babies go, the other thing, and we'll touch on it a little later, but at a certain weight category with an underlying condition called polycystic ovarian syndrome, which is an insulin resistant condition, as you lose weight, your ovulation comes back online. We saw it with keto diets, and now it's occurring with Ozempic. So unaware that you even have fertility, and as your weight comes down, before you even maybe have a period, you're pregnant. So that's the other Ozempic baby kind of situation.
But that is just basically getting your blood sugar in check, right? Metabolism, your metabolism is healthier.
Your metabolism is healthier on all fronts.
Yeah.
So all systems work.
So metabolic health is increased.
Yeah. So
Just-
in that instance, that would be good, right?
Yeah.
Yeah.
Real good.
Yeah.
Mm-hmm.
So yeah, I think in the overall umbrella of things that we'll talk about today, there's a lot of similarities about why we want better metabolic health. This is just one tool in the toolbox, and it's not always necessary, which is why you should be
Correct.
talking with your doctor.
Correct. Yeah. So there's different indications for it. Obviously, this medication was originally developed to treat diabetics. So it definitely improves metabolic health. So if you have someone with higher blood sugar, insulin resistance, overweight, obesity, that is one person where, the indication fits for, right? And then you have the other side where maybe they're metabolically healthy, don't have any blood sugar issues that they know of, but they just want to lose a few pounds too, right? So what is the right indication or who would I start it on? And so I've had to deal with that, right? With the popularity of these medications, I have people coming to me every day who have always struggled with their weight, even though they might look great from my perspective. They themselves, they're not happy with themselves. So,
the societal pressure of
Absolutely.
looking good.
Yeah.
And that is really where I'm seeing it too with my clients and people that I have trained is like I'm thinking they're progressing, they're gaining muscle, they're leaning out, and maybe just not at the fast rate that Ozempic and all of these drugs are helping people get to. And again, like what I think looks healthy and what's healthy on paper is not what society is saying is healthy. And for some of the clients that have the older culture where, it's skinny is the look, like,
You want to look like a hanger under
they
your
don't
shirt.
want their thighs to touch. It's like things like that we're battling. And so immediately I was angry at this kind of offering because I didn't see it so much as the body's wingman. Like it can be great. And I'm embracing that now that there's definitely a use for it. When I see progress and it's going and someone just kind of wants to press the easy button, essentially, that's hard for me because it's this whole skill set that you're getting with that drug. And we'll talk about it, but you cannot just do that and then come off of it and stay that way.
Exactly.
But the other thing with my age group is we have done stuff to our metabolism in the pursuit of a look that doesn't make it work the same. And then you add in hormonal menopause. Right. It's not a one size fits all. And the piece that has been so shocking to me with the clientele you're talking about, the patients we're talking about, is you have people who have battled their whole lives to look a certain way and have calorie restricted for such an extended amount of time. Their metabolism has changed. And they get access to this drug in a well-supervised situation, monitored, blood work done, the stuff that isn't happening in the other ways that we have talked about being able to get it. And the most amazing thing I've witnessed is for the first time in their life, they're not controlled by food.
They're in control. They're happy. So there's a mental aspect of it. And yes, like self-acceptance, no matter what size you are, right? But they're happier, And so...
and free. I would say free is the word that I keep hearing back from the exact people that we're sharing.
Here's my question on that aspect. They've starved themselves for a long time. We see it, right? They get on a GLP-1 where they feel free because they're not as hungry and they're losing weight, but they're still calorie restricting because of the medicine. So how do they get off of it, or is it a lifelong shot at that point?
That's the conversation that needs to be had before someone gets on it. So there are some people who can take the medication, do all the right things, which is strength training, making sure they pay attention to protein intake, because if you don't, you're going to have more side effects as far as losing hair. That's a big one that I see from a lot of people, is because they're losing so much weight, which is great in their eyes. They're also, because they're not getting the basic amino acid building blocks, right? You're going to be losing muscle, losing hair. So if they can keep their calories down, but their protein intake up, they're going to lessen those side effects. So you have the conversation with them before starting the medication that, okay, this is a medication that it may be hard to get off without getting the rebound side effects of gaining weight back. Mm-hmm. And so I always discuss the side effects with them, tell them that this is a medication where if we start it at a low dose, and then we only titrate up if you are at the point where you're not happy with body composition or still having some blood sugar dysregulation issues. And then we go to the minimum effective dose, right? And by doing that, you decrease the risk of rapid weight loss, because with the rapid weight loss comes the other side effects of hair loss and things like that.
And getting to a point where you're at such low body fat percentage, like your body as a woman is not functioning correctly.
Yeah.
That's one that I have to battle.
You do. And there are some people who start getting dizzy and passing out because they're not paying attention to, oh, did I eat today at all? So you have to have that conversation, discuss with them what the ideal diet and exercise routine is while you're on this medication. And then once they reach where they want to be body composition wise, then they can stop all of a sudden if they want, but expect that hunger to rebound, the weight to come back, and not necessarily, the same body composition where you were before. You might actually have lost a lot of muscle. And then when you regain the weight, it's going to be more so fat. So then you're kind of left worse off than when you before starting the injection
potentially.
at all.
Like if you don't follow a good protocol, you can actually recomposition your body to be in worse metabolic health afterwards. I mean, technically we could, right?
Yeah.
So that's why, again, I feel like you should be under supervision of your doc and hopefully a coach or someone on that aspect.
Well, and that's the thing is we're seeing our patients and our clients are the top percentage. Like they're the people that are getting informed. But I guarantee the majority of the population doing this is not. And that's why initially I was scared, worried. But as I see more information coming out, as we even have this conversation, it's going to be helpful, I think, for everyone to understand how to use it.
Yeah.
Because it's really important.
The big push right now, we don't have the answers as to how do you come off of it and is there a maintenance strategy. So there have been and are being tried a whole lot of things. One of the strategies is to, in a maintenance, monitor weight, and if it fluctuates within a certain percentage, instead of a weekly shot or a monthly shot or going back on, maybe a singular dose at intervals to maintain that. But the data for that isn't there.
Yeah, it's kind of you.
So this is out in the wild, what people are experimenting with to see what works.
Yeah, some of my patients who are on the maintenance phase will do kind of a higher dose once a month. And what I will typically recommend if they are looking to try to wean off is kind of, if they're doing a weekly shot, decrease it by a little bit every week and see how they feel, and then get to that lowest dose or even completely off of it and see how they do. So it's just little titrations here and there. And that's hard to do with the name brand because it's just, at least like the auto injector pens, because it's one dose, right? But with a lot of the compounded ones, you can draw up in your own syringe. And so you can play around with the dosing a little bit more. And so decreasing it per units. So let's say someone draws up 25 units. They would do that weekly until they reach the point where they're ready to wean. And then they would decrease it by, like, 1 week do 23 units. And then the next week do 21 units and kind of decrease that way. And then I have some patients who are like, don't ever take me off of this, because they like the control. They like,
the freedom.
Not
free.
craving alcohol as much anymore. So there's a lot of people who are able to continue the healthy habits because now they have this other tool that is available to them to allow them to work out consistently and not overindulge in things on a regular basis.
So I think something that's important, and we work with clients together, right? We handle the strength side. You guys handle, obviously, the medication side of it. And so, I mean, every study that I've seen that's come out is when we're, and any kind of rapid weight loss like that, you're not just losing fat, right? You're losing muscle. And as we age, and when I say age, past the age of 30, right? Mm-hmm. We start breaking down, we start the process of sarcopenia and losing muscle mass. So now if we add a drug in that causes rapid weight loss, you can expect what percentage? Half-ish?
Oh, it depends on the stimulus of strength training. So, yes,
Without strength training.
you can lose like equal amounts fat and muscle, which is not good.
No. So when we talk about losing muscle mass, just for when I think about telling people what that does is if you started to come off of it, your metabolism is going to be lower because your muscle mass is your engine, right? That is the biggest consumer of energy in the body is your muscle mass. So when we look at that, we want a metabolic engine, which is as much lean muscle mass as we can put on.
We need to market that. Like that needs to be sexy because I think women don't want to gain muscle.
Muscle is the most important organ in the body that we have control over.
Yeah.
That is the thing that we can make
Say
change.
it louder for the people in the back. Yeah.
And then I also think about armor. And I even talk about this with my high school kids is I have a lot of football players and they wear pads, but the more muscle I can put on them and around their joints, I consider that armor. I also talk about that with my 78-year-old client. As much muscle as I can put around that glute, the next time, if you do take a tumble, which I'm trying to prevent anyway, that's going to help prevent a break.
Absolutely.
And we know past the age of 55, 60, like a fall is terrible.
It can be devastating.
I can't remember if it's 65 a fall, like the survival rate of 12 months is like 50%. It's something crazy low.
Yeah.
Yes.
So
Armor.
muscle.
Yeah.
And then
armor. And then
quality of life.
Yeah.
You know, do you want to get down on the floor and play with your grandkids? Do you want to be able to take a suitcase and put it in the overhead bin on your on your flight? Like that's how important muscle mass is.
Well, and we were talking too just about metabolism as well. So metabolic health is so important, and people don't realize that can. They're just like, oh, food, timing. I'm gonna fast. Like, no, it's like also strength train.
Yeah,
is gonna help.
It also drives your metabolism, which increases your ability to intake food. But it's also where so much metabolism occurs. And it's seen in the studies with this, all-cause mortality drops if you can. And that's why one of the claims to fame about taking somebody who's obese and using a drug like this, all-cause mortality comes down. So that's also your cancers because of the metabolic health component driven by muscle.
right.
Amazing.
Because muscle is, when you eat sugar, that's where it goes.
It does.
And if you don't have the muscle for it to go there, bad things happen, right?
The lock and key.
Yeah.
Yes.
So,
Work out so you can enjoy life.
Exactly.
The key to life.
and I think that if you're on the GLP-1, why not kind of double it up naturally with a workout? So that may be another kind of sell on strength training is, we're going to signal the same kind of things. And so whatever dosage you're on, you're actually like taking a little bit more of a dosage. But strength training in general, you're going to help preserve that muscle mass that you have. So the breakdown of muscle is going to be less. And so you will lose more of that fat tissue versus strength, muscle. And when we talk about strength training, I think about things that could actually accelerate muscle loss. So people doing high intensity cardio, depending on if there's no impact or no real stimulus, if they're just doing long endurance, those things can actually help break down muscle faster. So when we talk about strength training, we are talking about big compound movements,
Load bearing.
heavy weights, progressive overload. So for those of you who may not know what I'm talking about, when I talk about big compound lifts, I'm talking about multi-joint. So we're talking about things you may have heard like deadlifts and squats and lunges and shoulder presses or bench presses and pull-ups. Like these are big movements. At enduraLAB, we're looking at fundamental movement patterns, right? Your push, your pull, your squat, your hinge, your lunge, core carry. So those are the things that we would want to see in a program. Obviously, if you're new to strength training, some of those are going to be body weight or maybe even assisted, but we want to get you into load-bearing heavy weight. This is not a 15 rep and I feel a burn. This is, I'm going to do 5 reps and I probably only have 2 left with perfect form, right? This is the type of loading we're talking about. Laura, Kathe, I mean, you guys both are in the gym and you guys both experience this, right?
Yes.
Right. And I think that the power of building that kind of strength and allowing you to do things that maybe you haven't done before is also just kind of a big win. And I used to be a hard no because it's an easy button. You know, it can be labeled as an easy button, especially in the fitness industry. And so when it first came out, I'm like, but you can't fight an easy button. So it's just like, how can we support it the best way?
And I've also seen patients who, because of the amount of weight loss that they achieve, now they're actually able to get in the gym and do all of those things.
Right.
And so again, I'm with you. At first, whenever it came out, I was hesitant. But the more that I've seen it being used in my practice with my patients, I've seen the benefits of it. And I will be the first to call out to one of my patients if they've lost all the weight, but yet they're metabolically unhealthier now because their fasting insulin levels are higher, or their fasting glucose levels are higher, which signals that they have lost more muscle. So then we'll really dial down, okay, like we need to pay attention to doing the strength training and then also feeding the muscles after you break them down, right? That's important. So timing of nutrition, especially after the strength training workouts, is very important too. So it's the constant kind of upkeep on someone who is taking the medications, making sure that all the right things are happening so that they can actually live a better life.
Yeah. It's not like you're taking this to give you the green light on eating bad food, which we're going to get into just in a little bit. There's still protocols that we really want you to do.
Similar with just fasting, right? So, you know, a lot of people do 1 meal a day fasting, which used to be more popular, a year or 2 or 3 ago. But some people would eat 1 meal a day, but it would be fast food, right? Yeah. So that wasn't healthy either.
Yeah, so we even talk about, I have a client that we work together and we were doing a lot of fasting, which I'm kind of off as far as me just because of protein intake. But anyway, he would be coming off these fasts and his first meal was not where we wanted it to be, right? And it took a while for him to kind of understand that. But I just had someone go through a 3-day fast and they're sending pictures of like the ice cream that they're going to eat. And and I'm just like, you're doing all this work. And then the first thing that you're going to do on this system who's ready to absorb whatever, the first thing you put in and you're thinking ice cream. You know.
Well, for the record, they won't do that again.
No. Yeah, because they're going to be
gallbladder attack.
Some GI distress.
They don't know.
No, I mean, so.
And I think that that's like a big part of the education with all of this. I think it's almost unfair for this drug or any drug to be accessible without the knowledge and the tools to really manage it before, after, during. I mean, nutrition and even exercise science, medical field, there's so much to know. But yet this is giving them the power to do something, right? And nutrition is tough. If you've never counted calories, done macronutrients, do you know what a macronutrient is? Like protein, carbs, fat. And to get what you need, the exact amounts you need, it takes experimenting, education. But when it's this fast-tracked, you don't have that much time to figure it out. So I think that's why there's a big bounce back at the other end, because it's like, oh, well, I didn't know that what a full whole foods meal is. So I'm just going to go eat my normal.
Yeah, I think that if you're finding it, if you're not under medical supervision, right?
Right, and you don't have a coach, and you're trying to figure this out.
So you found it online, you are looking at it as an easy button just to lose
Right.
10 pounds for your wedding or, an event coming up. I think that's the danger.
Vanity weight loss, yeah.
Right.
Right.
But
Have any of you all tried it?
no.
I really considered it. Because
have.
I want to know what it feels like.
So it's never going to be the same for everybody. But me knowing all this and on a super crazy low dose, which I did for a month and hated, I knew all this, and what went in my mouth was sugar. And it was such a small amount, but that's kind of what my brain sought. And so you can have the knowledge, but the drugs are powerful in what they do and how they drive you. That part was very interesting to me.
That is so interesting
But
to
I love
me.
that.
I do too.
I mean, why not? How can you talk about the effects? I have obviously several clients that are on it. And so I talk to them a lot about how they feel. And there's different ones. There's guys that are cycling on and off.
Mm-hmm.
They don't want to lose too much because they are concerned about muscle mass. So we get these guys who are like, I want to build muscle mass. I'm like, ooh, that's really hard when you're not eating, because you cannot do it in a deficit. And this guy is really in tune. He knows the dosage amounts and he can be like, I'm off of it. He even knows like how many weeks before his appetite starts acting up. So he's kind of, he's in tune, which is really nice to have a client or a patient like
It's
that.
really cool to see.
Yeah.
But I think that's really cool that you've taken it just to feel it yourself. We did have a guy who completely stopped alcohol, which for him that helps, and it can help things with like sleep. So there are things that kind of snowball good habits, which we've talked about. They feel better. They can wear their gym clothes that they want to wear.
Mm-hmm.
They come in, they start strength training. On the side of women, perimenopause, muscle breakdown, I mean, I would think that strength training would be number one priority. Would you say that is the case if you're putting someone on a GLP-1 in that stage?
So muscle mass and muscle mass loss starts at 30. And unlike with men, when you lose your hormones, there is a really rapid decrease in that first year. Bone mass loss is 15%, but muscle mass accelerates. And again, it's your driving metabolic engine. So in the whole armor thing, it's working differently in menopause. Your muscles coming down, your fat's going up. It's going to be mid-abdominal fat and padding around your hips, such that in this phase, if you fall, you have padding of a different kind.
Yeah, a little softer.
Not as effective.
Yeah.
Hard to say the most important, but if you don't have exercise and diet as the main component, the tools I have to affect that, the tools Kathe has to affect that, will still play a part, but they'll never be what they can and should be, because the two biggest things for anybody, age 7, age 70, that are going to affect wellness and health, diet and exercise.
And not to mention the cost, right? These injectables are not cheap.
Yeah, so what is
the cost?
there's a
of that?
prescription, right?
Yeah.
And I'm guessing on a prescription, insurance will, I know that insurance is kind of cutting back even on what they will take.
Name brand, the injections, if you were to pay out of pocket, it can range anywhere from $650 to $1,000 per month.
Yeah.
Yes.
Okay.
If insurance is
Maybe I won't be trying that. I'm
Yeah.
just kidding.
You can get it at compounding pharmacies for cheaper. It can come out to anywhere between, let's say, like $95 to $300 a month, depending on your dosage. So obviously the lower dosage that you're on, the more cost effective it will be. And so the more that you strength train and exercise, it's going to naturally enhance your natural GLP. So the less of the medication that you have to take. So in a lot of my patients who are doing the exercise and keeping up with their protein intake as much as possible, they're on like the lowest dose. And so they can make that medication work for them and not have it break their bank as far as, budget wise. And so that's another reason why you want to make sure if you are taking the medication, and again, it's a great tool for just overall metabolic health, mental health, it'll be more affordable for you if you exercise too, and your body's going to do just so much better.
Right.
So you won't have to keep going up and up and up on the dose. Or people who are at that stall, if at that time they're like, okay, I'm ready, and they add in the exercise and strength training, then they'll see, okay, now my body's starting to kick in. And even though I didn't have to increase the dose again, it's working better.
Now, the reason why strength training and getting the appropriate nutrition is harder is because, let's say you're in a deficit and your brain is telling you, like, I'm full, even though you're not getting the required. Let's say we always stress your body weight in grams of protein per day. Mm-hmm. That has to be really, it's difficult for me, and I'm not on the drug, right? Yeah. And nothing's telling me not to eat. And even though I love to eat, like, it's like one of those things, like there's people who, eat like birds. I'm not one of those, but
she is not.
I'm not. I love to eat, but even then it's difficult. Mm-hmm. So how, I guess.
Well, let's talk about what nutrition that we want to do, right? So like you said, protein is important. So you kind of want to go through.
So Kathe was mentioning earlier, you want to consume your protein around your workouts. Mm-hmm. It's very important to fuel yourself throughout the day so that you have energy as well. And so your body needs nutrients too. Like we had a podcast over protein, but it's like you're supposed to get so many ounces of water a day. Well, your body also needs a certain amount of nutrients a day. And if you're not feeding yourself those nutrients, your body is not going to perform the way that it should. And so we need to be making sure we have balanced meals, and we have a protein that, what did we say, was like 25 to 45 grams of protein, depending on male and female, per meal.
Size of the body.
Size of the body.
Right. Because you can get probably up to 60 grams per meal. Used to, the old saying was 20 to 30, but
you can actually
higher.
you can probably get more. It's just, can you eat that much?
Right, exactly, in one sitting. And that's the thing on these GLPs, like, you don't want to.
Yeah. So it becomes harder for sure. And so what I try to tell my patients is, eat your normal meal as far as like lean meat. So chicken, beef, fish, whatever. And then for dessert, you can do a protein bar.
Right. Yeah. Right.
Or a protein shake.
Or take some yogurt and put some protein powder and fresh blueberries.
Yeah.
But
delicious.
Ideally, like, did you want any of that? Like, could you palate it?
Oh, yeah. But it would have been an override, and it would have been a very conscientious choice, for sure. I can't get 100 grams of protein in a day working really hard.
It's hard.
Well, too, you guys, especially you when you're on call delivering babies, we talk about this with nurses. How hard is it to eat protein? You have to be mindful. You have to have it set out beforehand.
How hard is it to eat?
Like, do you even have time?
You don't.
Yeah. You're in a room, like an operating room or, delivery room.
I can see Laura like shaking up a shaker bottle.
I do.
One hand is like ready to catch the baby. Okay, here we go.
Just one more push. Hold on.
A year ago, I wasn't carrying those tools to continue. The other thing medical personnel in general don't do is hydrate, because you don't really have the bathroom break time, as crazy as that sounds, and of anybody who should know the importance. So especially now working out, getting hydration in on a call day, which for me now is always a post-workout day, is a crazy, conscientious 25 years of conditioning my body not to need water move.
Yeah.
So it is.
It makes me so sad that the medical profession is just run so ragged. Like, of all the people that are trying to make us healthy, like, you guys are suffering. That makes me so sad.
It's like when we talked about making time for a workout, we always talk about parents, especially moms, they should be taking care of themselves so they can take care of others.
Right.
Yeah.
And the medical field and the way the insurance works is driving medical professionals to just be snowed. I mean, anybody that's walked into a waiting room for their doc understands the issue. You know, they're just back to back to back to back because that's what they have to do. Otherwise, they're closing the doors to their clinic. But we won't get into too much of that.
Yeah.
So,
But I mean, it's hard.
yeah, so strategies, right? Like front loading before your day gets busy.
Yeah.
Like get as much in as you can as
Yeah.
far as like water,
And
protein content.
And
Well, and that's the problem that I kind of have with fasting too. And that is ingrained in people that's a healthier way to eat.
Yeah.
And you can't, like, you need to wake up and
make a
eat.
conscious decision to do it.
Make
Like,
a
I
conscious,
I don't like to at
Yeah.
the beginning of the day.
Yeah. Yeah.
But I think
Again,
that
I love to. I dream of my breakfast.
and our son, he does the same thing.
Yep. He gets up,
He
makes
gets
breakfast.
up, makes scrambled eggs, eats yogurt. He's counting his protein, which I'm kind of happy to see that going on,
It's
right?
cute.
Are you proud?
I'm
13-year-old.
super proud. Protein is so important, and we talk a lot about muscle mass today, but it's things like cognitive health, immunity, right? So don't think that we're just hammering this to build muscle, although with the GLP-1,
We have to.
We're definitely talking about it. Preserving.
Strategies too, like even the David bars we just got that are like 30 grams of protein per bar. They're like 28 grams.
Use that as your dessert, right?
Yes.
Yeah.
Yeah.
Seriously, I'll do a chocolate protein shake for
Yeah.
dessert.
Yeah.
It's not a big deal. But I think that when people are struggling to get protein in, it's like, how can we sneak it in?
Mm-hmm.
And with a lot of my clients, it is a smoothie, right? Because liquid calories are easier to consume,
They are.
usually not as satiating. So although we don't want a lot of our protein probably coming from supplements
Yeah.
when we need it, right? So if you need like the big hit in the morning, you can disguise 50 grams of protein in a smoothie, no problem.
Mm-hmm.
That fits in a liter bottle,
Yeah.
right?
And also logging, like charting what you're eating, how you're feeling, all of these things. So the client that is really trying to balance it and eat the protein and all that, like he has it figured out that he can get this much from this and this much from that. And he is strategizing it in that way.
He has core powers stashed at all locations of his, his ranch, his house, his work, his
Yeah.
car.
And once you kind of figure that out, or a few good days, I call that the playbook or the manual. Like you have a plan and we can keep tweaking that. Again, it's good to work with a coach and figure out those things.
Absolutely.
Your doctor.
Yeah. I think it all starts with having a plan at the beginning, and then you got to work back, right?
Mm-hmm.
Like how can I make protein more easy? How can I make my workout? And so it's just things about, when you're sitting down with you guys, obviously there's a lot of conversation. With nutrition though, when clients get on, or a patient gets on GLP-1, is there more supplementation that's going in with blood tests? We've talked about trying to get as many nutrients as you can if you're not ingesting as much.
Mm-hmm.
Yeah. I mean, it depends on what their levels look like, but a lot of times it depends on symptoms, right? So if they are having hair loss, then we would, number one, make sure they're getting as much amino acids or protein, that they're meeting those minimum requirements. And then, you can look into supplements that help with collagen production. So taking collagen itself or colostrum, which can help increase collagen production.
That's a new hot product.
Mm-hmm.
Yeah.
Yeah. Or even
how do
things
you
with
take that?
biotin.
Is that a
It's a
powder?
powder.
There are powder forms. There are gummy forms.
From the
Okay.
breast.
Okay.
Yeah. You get it straight from the source.
OG colostrum.
I mean, yeah.
If you got a mom in the house.
I wish I would have saved
Your
all that
baby.
milk. I was a cow when I was breastfeeding. Like, yeah.
We have a funny breast milk story, but we won't go
Oh,
into it.
you're not going
Yeah.
to tell?
No.
Oh,
no.
tell it. Don't hold back.
We'll save that one for a
basically-
later
no,
date.
No, basically, I went out of town to go to a training, and Lee had to borrow breast milk from my good friend at the time for Isla. And at first, I was like, you're giving someone else's breast milk. Then, I got over it.
It's just such a funny story because, you know your sources when you're having a baby. Usually you make friends with other people with babies in their time. And Isis had both of our children at the same time as this friend who you guys work closely together. And so anyway, I knew I had someone I could call, which is an awkward
It was
text.
more like a failure thing for me that I did not leave enough milk. And I was like, oh my gosh.
It was like something on the black market. She comes down with like a big Yeti cooler just stuffed with frozen breast milk. I'm like, thanks. How much do I owe you? Yeah.
We call that milk trading.
Yeah. Which is awesome. But like, let's say like fiber intake and greens.
Yeah. So constipation, right? That's a common side effect. So if they are on the shot and they are experiencing those symptoms, you would up their magnesium, making sure they're hydrating properly. But magnesium citrate is great for inducing bowel movements.
Yeah, don't take it if you're just like on a normal day.
Yeah.
Right?
Yeah. If you're having diarrhea, don't take it. Okay.
Because basically that's what you're taking before you would get like a
Colonoscopy.
Oh,
yeah.
That's a clean out.
Citrate.
Yeah. Mag citrate. Yeah.
I can't wait for my first colonoscopy.
Oh, that's going. That's a sound bite. Says no one. All right, so when we're talking about kind of GLP-1s, obviously most of the studies are around men. So when we're looking at...
Look how he said that.
What?
Most of the studies are around men.
No, but it's true. Like if you look at the whole medical profession and drug testing, and a lot of it is around the male client. So there's a lot of females that are getting onto this.
Do you think there's more male or more female getting
I don't
on
treat
this?
men, so.
Right
Not
now,
yet.
it's actually 50-50.
Got my first.
It's about 50-50?
Yeah.
Okay.
Yeah. Everybody is looking to improve their body composition, feel better, right?
Yeah.
But you
So
all know that from the gym,
Yeah.
Yeah.
for sure. That is.
I don't know. I guess I work more with women, so I see it more in women. And I can't tell with the guys because they're not necessarily telling.
they're not going to talk about
No.
it as
Yeah.
much.
The one thing I actually see the opposite. All of my male clients will come in and tell me straight up.
Yeah.
I would say that's true.
Female clients have to dig.
Yeah.
Hey, what's going on?
Yeah.
Hey, I've just noticed there's been a drop. So what are you doing? Are we working on food? How are we doing that? Are you logging?
Yeah.
And then some people will never tell you, but they're
But
dropping
they have
it so
Ozempic
fast.
face.
Ozempic face, right? You start to see the droop. You start to see a little bit of the skin sag because the weight loss is so rapid, the skin has no time to kind of
I guess that's with any drug, though. If someone's on medication or doing something outside of the gym that we don't know about, that's why we're asking these questions no matter what. It's not like we're GLP attacking.
I always tell clients that we have to become best friends, right?
The more you share, the better that we can serve.
Yeah.
And that's
the better the results that we can deliver.
Right.
And that goes with your doctor or your coach, right? Especially
All
with
of it.
yes.
We'll have clients that we share and, I'm always like, do you know? I think you might want to ask a question, because that's the scary thing too for medical professionals if you're a patient and you're not telling your doctor all the things that you're on because you don't want them to know that they cannot serve you better.
Right.
If you're with a coach and you're not telling them things that you're doing on the outside, you're holding back, you're preventing yourself from making...
Here's an innocent
reaching your
example.
goals.
Yeah.
Innocent example. We have clients that struggle with sleep over and over and over again, and they are doing nothing wrong in their eyes. And then it's like, oh, but actually I had like 3 glasses of wine. We're like, okay.
It's always
So,
the fun things with like...
But that
just
won't
tell
come
me-
out till like minute 45 of an hour session.
No, you got to dig into it, So it's like...
And you may not know.
You're not
Again,
sleeping better.
education goes with that. Like they're not seeing that as a sleep disruptor or even an issue. Or maybe they didn't even know they had 3 glasses of wine last night. I wouldn't know. I'd be passed out.
Yeah, you would be.
Oh my gosh, I'm a lightweight. But again, if you don't know certain things that affect your lifestyle, because it is something you've done. You've conditioned yourself not, oh, I think I drink water, but you don't because you couldn't for so long.
Question, the answer that I always like is I eat a lot of protein.
And I drink a lot of water.
A lot of water.
I get
That's
a lot of
relative
sleep.
term. Yeah.
I eat pretty clean.
My blood pressure is normal.
Yes.
What is normal? Give me some numbers.
Oh yeah, give me your numbers. What is the normal? I've been
good.
wanting to know.
Yeah. So all of it's there, but the more that you can share and know that we truly want to help. I'm not here to judge. I make fun of the 3 glasses of wine, but you know what? Like I'm not judging. I'm just curious, and that helps me problem solve because I don't know how to help if I don't know what's happening.
Yeah, I think everybody is trying to get to the root cause of a problem because everyone sitting around this table, our main goal is to help people. We're looking to help you reach your goals. We're looking to help you guys live healthier, happier lives. Mm-hmm. So we want to know. And it's not a thing like I want people to trust their docs. And we've talked about this before. You should be able to have a conversation with your doc, and you should be able to have a conversation with your coach. So if you're not, it's time to look because you have that power, right? And so we want all clients to feel open and feel like they can talk to us, obviously, about what's going on and what they want to do, right? So we can help them.
Yeah, agreed.
And so today, GLP-1. So I think, it's just interesting to know what a GLP-1 is doing, right, inside the body. I think people just look at it as my buddy's on GLP-1 or Ozempic or Manjaro, or Kilimanjaro. That's a new one that we're compounding at the lab.
It's the next one. It's a GLP-2, the one that makes you want protein and recovery.
Yes.
Yeah. And these drugs are not going away.
No, they're not.
It's just going to get, honestly, there's going to be more options. There's another one coming out. I think it's called retatrutide that hits 3 receptors. And so the studies right now, I think they're in phase 2, but it shows a even better weight loss outcome than Mounjaro Zepbound, which is tirzepatide, which for most people works better than semaglutide or Ozempic. Okay. So each one that comes out is just getting better and better. Do you ever think back to Scythe?
My gosh.
All the time, right?
Are we going to eradicate all disease?
Oh, yeah.
Wait. So, break that down. Did they make like a...
So in Scythe, which is an awesome book. Anyone who hasn't
Great series.
Fictional.
Fiction, but is it?
Yeah.
What is it? Okay.
So you have the power to control your weight. You can be bigger, you can be smaller, and there's little nanites that are in people's bodies that can just be tweaked.
Auto healing.
Yeah.
There's no more disease. AI is taken over. There's no more war. There's no more governments. AI controls everything. There's no more hunger.
When was this book written or series?
I don't really know. Kathy's the one. You actually are the one that started me on that journey, and I I nerded out afterwards. But basically, you've eradicated anything that shortens lifespan.
The first book was 2016.
Oh.
Basically, there's how do you control population?
Yeah.
There is a group of people called the Scythes, the Scythedom. Anyway, if you have some spare time and you're looking for a good read, this is recommended by a doctor and a coach. So take it for what it is. But yeah, Scythe. It's only going to get better, right? And data is moving so fast. That being said, it's moving so fast that we don't have a protocol to come off of it.
Agreed.
So you have to understand.
And you have to understand that as these medications get stronger, what is the downstream side effect? Right? We still don't know. I mean, GLP-1s have been around for 15 plus years, and we haven't seen like a danger signal that has made us say, okay, these medications need to be off market. But again, as they get stronger and stronger, so you have to accept that there is still some unknown. And as long as you make a informed decision and understand those risks and benefits, do what you want as long as it's not going to hurt you.
And do
Yeah.
the basics.
guidance.
With
With
under
guidance.
medical, yeah, with guidance.
Well, and do the basics. Like you
Yes.
have to inform yourself on proper nutrition, proper exercise, proper rest, recovery, all that. So make sure you're still doing the basics. This is just a tool, a helper.
It's really a 3-pronged plan, right? You've got your GLP-1 or whatever we're taking. You've got nutrition and you've got strength training. So when you decide that you want to do this, you should plan for all 3, right?
Mm-hmm.
Don't just take the shot.
A couple of points just to swing back around. Whenever medical advances come out, there is always a financial incentive to their implementation. And because of that, you can get these drugs on just about every corner. And there is a real difference between doing something that Kathe or myself would do in guiding you through this versus finding a location that will distribute it and potentially minimally support it. But implementation is everything. I think ideally, especially even knowing what I know, having taken it personally for a short period of time, the ideal way, if you're not treating obesity per se, would be to get your diet in place, to start your exercise strength training program, and then add it in on top, because to make all 3 of those changes at once would be virtually impossible.
Right.
So those are my public service announcements.
I love it.
I do too.
So yeah, so we are saying, I think, all the same thing. And when we get out to, there is a danger because there are businesses that are making it, and they're treating so many people, they can't have that conversation. They're just saying, hey, here's your shot, amp it up. And the dosage.
Sending you home with a vial.
Yes. And I know my clients, there are definitely ones that are like, man, if I'm getting a good result with 25 units, what would I get with 50? I mean, it's happening. And they're not going to they don't have to tell that doc, right? And then what's the scary thing is when they come to your office and they're like, hey, how's it going? And they're like, great. Wow, you've lost some weight. What are you doing? Oh, nothing.
Mm-hmm.
That's scary.
Mm-hmm.
Especially for a surgeon. One of the things we know because of the rapid loss, it doesn't just affect muscle and fat. It affects tissues that we use for strength, like fascia and healing. So there are now some guidelines around pulling off of it for surgery and waiting to go back on. But again, because this is a hidden drug, I specifically ask when I'm planning surgery because we noted people were not healing well. And so it plays big there. The other thing surrounding pregnancy, you've been on it, you've lost weight, you made an Ozempic baby. Oh, that's a hard place to be because you're in a nutrition deficit, and we're talking about pre-planning going on your semaglutide. Our pre-planning for pregnancy is 18 months of nutrition now.
Which I love that.
So
I think that's so awesome.
So you're going into a pregnancy at a bigger deficit than just somebody who might be eating a regular diet and not exercising. There are a lot of implications, and catch up is hard and will never be as good as planning.
Yeah, because like you said earlier, those moms or to-be moms, they need to make 3 changes immediately or 2 changes immediately, right? Nutrition and probably exercise. So that's a really hard change really fast. Like, oh my gosh, I'm pregnant. Didn't think I could be. Now we got to make these other lifestyle changes and prep for a baby.
It's kind of interesting. Sometimes it's the first time, what can I do for exercise? And my very next question is, what have you been doing? Well, nothing. It's
Okay.
a hard place to be.
Yep. Start slow.
Start slow.
Start slow.
Just like everything.
Move your body.
Yep. Go to somebody who knows what pregnancy is like. All right.
Okay.
So I guess to kind of wrap it up.
We talked about a lot today.
Yeah,
We did.
It was good.
Good
It was awesome.
conversation.
Yeah, I love this.
Yeah.
I love this. Just educating people, because I think that's the biggest thing is it's going to be out there. Like I said, you're going to have a friend on it, or you're on it, or a family member on it. And the more you know, the better off you're going to be. Okay. So first, I think to sum it up, if you're thinking about going on it, please consult your doctor. If you don't have a primary physician, find one. From there, you got to be open, right? We understand now that it's kind of a three-prong approach. Like Laura said, if you're on your way, or maybe if you're searching for a physician, start thinking about nutrition. Start thinking about developing a workout plan, or how you're going to make that a thing that is a regular occurrence in your life. When you get on it, we start small. There are side effects. Also know that we really don't know the protocol of coming off on it.
Yeah, and I do think that ultimately, like, there should not be a negative connotation or association with this medication, because I think in the past there was, right?
Yeah.
Or there may still be, but just like with any other diet or lifestyle intervention, you just have to know how to use it.
Yeah.
And
it's-
use it safely.
Yeah, if you are going to use it.
Yeah, I think the shame around something like that, and I think it just comes around the shame around body image, right, from others, or what you're thinking about yourself. It gives that privacy in which you don't want to talk about it. But we're
Well, and it's
asking
not just
everybody.
internal, but it could be external. I saw a video on Instagram about a coach that had a client that had lunch with her girlfriends, and the girlfriends were on it and she wasn't. And they were like, why are you not just getting on it? Why are you working with a trainer? You could have this done so much faster. And that, in that social group, made that person feel bad. And then the coach was obviously sharing and just being like, I'm so proud of this person for, you know, working out and doing all the things. And if she wants to use that as a tool, she can. But it's also that, like, it's a social shame too. It's not just an internal. And so
Right.
I'm ready for that to be gone too. I do want it to be more widely accepted, like a Viagra.
Yeah.
Okay. So yeah, I think there's that. I think the takeaway is that, like Kathe and everyone is saying, it's okay. Like we're going to learn how to coexist, because it's not going away.
It's
Yeah.
not.
And we're here to support it.
Yes. We're here to support you. We're here to help.
That's right.
Yes.
All right. Well, thank you.
Thank
Dr.
you,
Supavong, Dr.
guys.
Bradford, or I call you guys Kathe and Laura.
Yes.
Thank you guys for coming on to the podcast today
Thanks
and
for having us.
discussing such a interesting topic, and
Yes.
one that is, like we said, it's a little bit out there. There's still some negativity around it, so hopefully we've enlightened some people.
Yeah.
And it's definitely helped open my eyes to it as a trainer, coach, gym owner. And so thank you guys for doing that today.
Thank you.
Thanks for tuning in. If you found this episode helpful, please share it with someone who needs to hear it. And don't forget to subscribe, leave a comment, and let us know what other topics you'd like for us to cover. And as always, you can catch us on Instagram at enduraLAB. Until next time, keep moving.
Eat well and stay strong. Thank you.
Peace.